Because of the increasing concern about this virus, we'll be giving you information and update regarding monkeypox. So, monkeypox is actually a rare disease caused by infection with the monkeypox virus. The monkeypox virus belongs to the orthopoxvirus genus in the family of Poxviridae. O, diba? Is it okay pronounce? So, yung orthopoxvirus is actually kasama na din yung variola virus, which causes smallpox, vaccinia virus, which is used in the smallpox vaccine, and the cowpox virus. So they have the same family of viruses, but yung monkeypox is not related to chickenpox. So hindi sila kapamilya. So monkeypox was first discovered in 1958 when 2 outbreaks of the pox-like disease occurred in colonies of monkeys that kept for research. So despite being named as monkeypox, the source of the disease remains unknown. So however, the African rodents and non-human primates like monkeys may harbor the virus and infect people. So the first human case of monkeypox was recorded in 1970. So since then, the monkeypox has been reported in people in several other countries and Western African countries. So prior to the 2022 outbreak, nearly all monkeypox cases in people outside Africa were linked to international travel to countries where the disease commonly occurs or through imported animals. So, yung mga scientists ng CDC are tracking multiple cases of monkeypox that have been reported in several countries that don't normally report monkeypox. So, in this data, there as of June 17, there were about 2,527 confirmed cases, and among yung mga countries na affected were about 37 countries. So pinakamataas dito is yung United Kingdom. So the symptoms of monkeypox is similar to smallpox, but it has a milder symptoms. Yung monkeypox is actually rarely fatal, so it is not again related to chickenpox. The first symptoms of monkeypox include fever, malaise, headache, and sometimes sore throat and cough. So a distinguishing feature of monkeypox from smallpox is the lymphadenopathy or swollen lymph nodes, or in Bisaya, lusay. So yung monkeypox nagkakaroon ng lymph nodes swelling, pero sa iba wala. So this is typically occur around 1 to 2 days before rash occurs. So lymph nodes may swell in the neck, in the groin, and occur in both sides of the body or just one. So yung typical rash niya, the rash can look like pimples or blisters that appears on the face, inside the mouth, and other parts of the body like the hands, feet, chest, and the genital anus. So the rash goes through different stages before healing completely. This process can take several weeks. So matagal yung healing process niya. So sometimes people get a rash first followed by other symptoms. Others only experience rash. So, yung difference ng monkeypox and chickenpox, kasi yung what is common to us is the chickenpox. So, to differentiate lang, so although both diseases cause a rash with small blisters, there are actually differences in the type of rash caused and the distribution of rash on the skin. So, yung chickenpox, it actually affects only one part of the body, but the monkeypox can affect the entire. So, any person contracting either of the two diseases will be able to tell the difference. The monkeypox also has asynchronous lesions. All the lesions usually look the same at any given stage of the disease. So, unlike sa chickenpox na siya different stages, the skin lesions caused by the monkeypox virus also look different from the chickenpox. It usually has a swollen lymph nodes, as what I've said a while ago, and yung rash niya is usually whitish in color compared to chickenpox. So, ito yung rash. So, compared to the left side, medyo mapula yung rash ng chickenpox. So, how this disease is spread? So, the virus can spread from person to person through direct contact with the infectious rash, scabs, or body fluids. So, yung direct contact, usually, it happens at most 3 hours na direct contact. So, mapapansin natin, it really not that contagious compared to other disease like COVID-19 na 15 minutes ka lang na-expose, pwede ka nang ma-contract yung virus. But this one, it takes 3 hours direct contact bago mo makukuha or possibly makukuha yung virus. So, you can also get the virus from respiratory secretions during prolonged face-to-face contact, during intimate physical contact like kissing, cuddling, or sex. Touching items that previously touched the infectious rash or body fluids. Pregnant people can also spread virus to their fetus through the placenta. So, monkeypox can spread from the time symptoms start until the rash has fully healed and fresh layer of skin has formed. So, this actually can take several weeks. And people who do not have monkeypox symptoms can spread also the virus to others. At this time, it is actually not known if the monkeypox can spread through the semen and vaginal fluids. So, alams na. So, how this actually during intimate sexual contact, we know that the virus can spread in fluids or pus from monkeypox source, and trying to be better understand if the virus could also present in semen or vaginal fluids. So, wag na lang. If there are suspected person who has these symptoms, better yet, avoid na lang having intimate sexual contact. So, this is actually the laboratory process for monkeypox virus testing. First, the patient is evaluated for monkeypox by the healthcare provider. So, next thing is the virus will be tested for RT-PCR or confirmatory test. If negative siya, then pursue to other diagnosis. But if it's positive, then the patient shall be isolated and treated. So, ito yung actually ginawang algorithm sa CDC. But for our country, wala pa naman kasing cases. So most probably we can learn from these countries na nagkakaroon na ng mga cases. So for the prevention, first avoid contact with animals that could harbor the virus, including those animals that are sick or that have been found dead in areas with monkeypox incidents. So, yung mga animals like rabbits, rodents, and monkeys. So, usually, sila yung mga most probably nag-harbor ng virus. So, avoid also to contact with materials such as bedding that has been in contact with the sick animal or sick patient. Isolate infected patients from others who could be at risk for infection. And of course, practice good hand hygiene after contact with infected animals or humans. For example, washing hands with soap and water or using alcohol-based hand sanitizer. And lastly, use proper PPE when caring for patients. So sa prevention, aside from what I mentioned, may bakuna din, but unfortunately, it's not available in our country. So this is the Jynneos vaccine, also known as the Imvamune or Imvanex vaccine, and it's actually a US approved, FDA approved vaccine for the prevention of monkeypox. So this is actually given or recommended for pre-exposure prophylaxis as an alternative to person who are at risk of exposure to orthopox viruses. So aside from monkeypox, pwede siya ibigay din sa mga smallpox cases. So sa treatment, there are no treatment specifically for monkey virus infection, no? But however, the monkeypox and even smallpox viruses are genetically similar, so which means that the antiviral drugs and vaccines developed to protect against smallpox noon may be used to prevent and treat monkeypox viruses now. So the antivirals such as this one, the Tecovirimat, may be recommended for people who likely to get severely ill, like patients with weak or weakened immune system. So as a general, actually, for this disease, yung ginagawa lang sa hospital, usually supportive care. So, for example, the patient has experiencing muscle pain, fever, so binibigyan ng pain reliever, or nag-hydrate, depende sa symptoms ng pasyente. So, ito yung, ang importante is the supportive care. So, that's all, basically. So, I got the information about this lecture at the CDC website. So that's all. Thank you.